All right, let's talk about what's the difference between cosmetic liposuction and lipedema liposuction is. A lot of people feel like it's the same thing, but it's not. And I want you to understand the principle so you don't get confused. So if you're looking for cosmetic liposuction, let's say hypothetically, and I'll use my fingers as a prop. So let's say you don't like the area on your hips. Let's say it's bulging a little bit, right? You go to a cosmetic surgeon and they'll tell you, we can do liposuction to the area, no problem. Great. They use power liposuction machine, they use power liposuction cannulas, they use garments, and they're going to liposuction that area where you actually have an issue. All right. The difference between cosmetic liposuction and the lipedema liposuction is really not in the equipment that we use, in the way we use the equipment, how we use the equipment, and in the way the liposuction is done. So here's the difference. If you have lipedema in your lower extremities and you have bulging, say, only right here, and your cosmetic doctor or cosmetic surgeon or plastic surgeon who is not familiar with lipedema is going to treat only that area, guess what's going to happen? You're going to have a recurrent condition of lipedema or recurrence of lipedema every single time you have additional estrogen or hormonal change, whether it's be pregnancy, it's going to be menopause, AVF, Lupron, whatever, birth control pills, whatever. When patients come to us for lipedema surgery, even if your area of main pain is, say, only right here, we would still have to treat most of the time the whole leg, because the principle of lipedema surgery is different. What we're trying to do, not only remove the painful fat, but we're trying to create almost like an internal stocking. So eventually, by doing the surgery in the front and doing surgery in the back, your whole leg is surrounded with a thin layer of scar tissue that works as internal stocking. So that ideally, if in the future you have hormonal changes that will precipitate recurrence of lipedema, then that scar tissue is going to somewhat decrease the chances of the leg swelling up to the original condition. And the way we know it is when people do lipedema treatment for the upper extremities and they do only the arm, people come back a couple of years later and guess what? They have collection of extra painful fat here and on the arms, and they look like Popeyes. So the difference is, again, not in the equipment that we use. Most plastic surgeons use power-assisted liposuction or water-assisted liposuction. It's not in the cannulas, even though some cannulas are modified. It's the way the surgery is done. You have to treat the whole leg. If you do just minor areas here and there, this is not a lipedema liposuction. That's a cosmetic liposuction, and you're not going to get long-term result that you're looking for. The other thing is, be very careful in the areas where we're not trained to do liposuction. When I was learning how to do liposuction over 20 years ago, we were told not to go around the ankle, not to go in the area where major superficial nerves are. And indeed, you can easily damage the nerves and you can easily damage the tendons by scraping them with the sharp edges of a liposuction cannula. So there are special techniques that are used in order to prevent doing that, and they're kind of counterintuitive to what we're taught as how to do liposuction for cosmetic reasons. So I still do cosmetic liposuction, but I do it differently than lipedema liposuction. And finally, the solution that we use for liposuction is somewhat different, and a technique that I used on the inside of the leg where most of the lymphatics are also different. There are certain areas that you should not go into with liposuction cannula in lipedema patients because you're risking the risk of permanent or long-term lymphedema issues. All right.